First community conversation, we are joined by Dr. Madhu Misra, Physician-in-Chief for UVA Health Children's. Hey, Erin.
Thank you, Kate. Dr. Misra, thank you for coming in today.
Well, thank you so much for having me.
Yeah, we're here to talk about some pretty exciting news. So UVA Health Children's was just ranked #1 for best children's hospitals in the state of Virginia. So congratulations on that.
Thank you so much.
And it was announced by U.S. News and World Report. So tell us about that ranking and how do you guys feel about it?
Well, we're delighted.
Yes.
The #1 children's hospital ranking is something that all children's hospitals aspire for, and we've now had this 5 years in a row. We were also nationally ranked in 9 out of 11 specialties, so definitely very proud of the team that got us there. It's really the excellent care that all the providers, the physicians, nurse practitioners, nurses, trainees, and other health professionals provide to our patients and their families that gets us those outcomes that get us this ranking.
Yeah, a very well-deserved ranking for sure.
Well, thank you.
Of course. And what are some of the criteria for being ranked #1?
Yeah, there are many factors that go into the ranking, and I think of these in 4 broad categories. The first and probably the most important is patient care outcomes. And this includes attention to mortality rates, recovery rates from various conditions, infection control, management of complications. The second category is the processes that get us those outcomes. So how well do we adhere to best clinical practices and guidelines, care coordination that we provide to our patients. The third category I think of as the resources that the healthcare system provides to pediatrics and the children's hospital. And that kind of gets to personnel, nursing ratios, healthcare technologies, pediatrics, specialty services, and certifications. And the final category is really reputation. So how do our peers perceive us? And that's expert opinion.
Very nice. And as you mentioned earlier, this is the 5th year that UVA has ranked #1 in Virginia. So what does that say about your team? Obviously, you all are a very impressive group.
I think it's a wonderful team, and they're really a dedicated group that is very passionate about healthcare, very compassionate people. The teamwork and the professionalism is incredible in ensuring that we adhere to those best clinical practices that get us those patient care outcomes. I would also say that it reflects the investment that the healthcare system has made towards the children's hospital in terms of providing us with the personnel and other resources to get those outcomes. So yeah.
That's great. And then what are the plans for the future? I know you guys want to keep your #1 ranking. So what are the plans for enhancing care for patients and families?
Yeah, so we have done a lot to improve our outcomes for healthcare, in terms of what we talked about, the survival rates, recovery rates, infection control, management of complications. We worked on optimizing the healthcare we provide in terms of adhering to best practices, the resources, but there's always room for improvement. And so we definitely are working towards identifying any care gaps that exist and working towards filling those gaps. I would say that access is something that we pay a lot of attention to because we want to be sure that any child that should come to us or is referred to us has the ability to get to us. And so we put in a lot of effort into expanding both our inpatient and ambulatory services. And on the inpatient side, we are expanding our neonatal ICU beds from the current 64 to 100 beds in the next couple of years. We plan to double our pediatric ICU and cardiac ICU beds, and that should help us bring in all the children that have significant complex medical conditions that can be cared very effectively and efficiently given the expertise that we have in the children's hospital. On the ambulatory side, also we're expanding greatly, certainly to north of town in the Riverside area. We also want to develop our multi-specialty programs and centers of excellence because with those programs we enhance care quality, outcomes, and patient experience. At the same time, we also want to be sure that while we grow the clinical enterprise, that we are at the forefront of research innovations because research is what advances medical knowledge and clinical outcomes. And being a highly ranked academic medical center, it's incumbent upon us to do that. And for the same reason, it's important for us to provide the highest quality of education to our trainees. And I think we have great educators, but at the same time, we need to innovate when it comes to education because things change every year. And so we want to be sure that we provide that high quality education as well.
That is wonderful. Well, congratulations again on the ranking. And Dr. Misra, it was great having you here. We'll see you next time.
Thank you so much. I really appreciate the opportunity.
Of course, anytime.